Hi, thanks for joining us here at this final section of cardioprotective activity patterns. And I've got here today in the Shane's Pulse studio with me a good friend of mine and a supporter of the message, Troy Simmons, current AFL ruckman for the team, the Richmond Tigers. Thanks for joining us, Troy.
Thanks, Shane. It's a pleasure to be here.
Yeah, thanks. Look, the reason that Troy is here, I just want everyone to let everyone know, is that a few years ago you had a brush with your own cardiovascular event, which is very unusual for an elite athlete, but also very unusual for someone who's so young. Could you please tell us about what happened, Troy?
Yeah, it was back in 2007 AFL season. Late in the season, I had a brush with a cardiovascular event that hospitalised me for a week, and then I had medical intervention for the next 6 months.
Wow.
It's known as a pulmonary embolism, PE. What a PE is it's a sudden block of a lung artery, and it usually comes from a clot in the lower half of it comes from my leg, so it travels up into the lung and into the pulmonary artery, and most people, a lot of people, can die within the first hour of having this.
Is that right?
And I had symptoms for a week. And
did you play with this pulmonary embolism?
I did. I was against Geelong down at Cardinia Park one week, and I was coming on and off the ground every 5 minutes, just absolutely exhausted. I didn't know what was wrong. I thought it might have been a virus. I was coming down with a virus, but I just said to my fitness staff, who's on the bench at the time, that I just can't go today. And I was on and off the ground every 5 minutes, and I had tests done after the game, thinking I might have been coming down with a virus. I didn't, so I tried to go out and train that week, and there was I just couldn't go. I couldn't even run a lap without being exhausted. So I thought.
So were you out of breath? Is that what it was?
Yeah. I was just really out of breath, and finding it hard to get the oxygen in. And I had some other tests then done through the club doctor, and I still couldn't come up with anything. And it wasn't until then I started getting some symptoms where I was getting some sharp stabbing pains in my side, my chest, and up in my shoulder.
Yeah.
So,
which for people who are watching this video learning episode, those are some of the symptoms of heart and blood vessel disease that many people don't know about.
Yeah, and I counted that totally out because.
How old were you at the time?
I was 28 at that stage, thinking. Having something wrong with my heart or anything like that. I didn't know a lot about heart disease back then, and I just counted that out. I just thought, I'm fit, I'm healthy, I'm young. Yeah. It's meant to happen to older people.
Yeah, that's right.
So, I totally counted that out, and I was very surprised when I went and had a scan of my full abdomen, because we thought it was something with my gallbladder. Yep. And then the nurses then picked up. I had several clots the size of about 6 centimetres in my lungs.
Wow! And
they wheeled me straight upstairs into the room, and that's when I received all the treatment.
So immediately you said, I think we were talking previously that you said you were in hospital for a week, flat on your back, couldn't get up. Is that right?
Yeah, I wasn't allowed to move around. I had to keep very stationary, and I was treated with Clexane and warfarin, which is an anticoagulant drug.
That's used, by the way, warfarin is used for people who've had open heart surgery.
Yes.
And so it's almost like you were treated as though you'd had open heart surgery. That's how dangerous they're telling you it was.
Exactly. And a lot of older people actually on warfarin for the rest of their life. So I had heard of that, but then I was told I had to be on it for 6 months. So
wow.
I wasn't allowed to. I could train. I could go and train once I was fine, but I wasn't allowed to be involved in any contact for 6 months.
Yeah, because of the blood thinning side of it?
Blood thinning, yeah.
And one of the things that you said to me in a private conversation, that the doctors at the time gave you a certain percentage chance of living as a result of this pulmonary embolism. What was that?
Yeah, it wasn't until I went back and saw the specialist in January of 2008. And he said to me, I still remember his words to these days. He said, "You're a very lucky boy." And I sort of took a bit of a backwards seat. And he said I had about a 7% chance of living, and it was probably due to my fitness levels and being an AFL footballer for 11 odd years.
Yep.
that probably got me through, and the pain barrier wasn't, you know, I didn't complain too much about it. I was just hoping to play
Take it on
week.
the chin.
Yeah, I just wanted to play next week. And
so let's just cover that just a second ago. You said you had a 7% chance of living. Is that what he said to you?
yes, that was what
So a
he said.
93% chance of death as a result of a pulmonary embolism. And, you know, heart and blood vessel disease, as we've talked about, is the leading killer. And thankfully you recovered from that very well. Everything's fine now, no problems?
No problems. I walked out of there still not knowing exactly why or how.
Yep.
And that bugged me for a long time.
Yeah, as it would.
And because he did say to me that you'd be surprised, there's a lot of people walking around these streets with clots in their legs.
Yeah.
And that type of thing. So I wanted to go and find out why, because I had a career that I was, at the age of 28, I still got a fair few years.
Yeah, a number of years to go.
To go in my football career, and if it happened again, I'd probably have to retire and be on warfarin for the rest of my life. So I went out and it was probably the tipping point for me to go and discover, I suppose, my passion in health now.
Yep.
And I do have that's why I'm here.
Yep.
I have a passion in health and helping others.
Yeah, and you know, you mentioned something called a tipping point, and for most people who would watch this video learning episode, a tipping point occurs when they have that cardiovascular event. You're unfortunate to have it so young in life, but fortunate from now being driven to learn about it and to teach others, you know, and be a part of this message. And so that leads us on to this next session that we want to finish up on, in terms of, you know, the title of this episode is called Discover the Beat of Your Healthy Heart. And I want to talk to the audience, I guess, about a topic called